Hello. Hi guys.
Hello.
Hi. Can you hear me? سامعني كده؟
Yes.
Yes.
How are you doing everyone? عاملين ايه؟ ايه الأخبار؟
I'm doing great.
Hi سهى. طيب كده الصوت كويس، سامعني كويس وكل حاجة، صوتي واضح وصورتي واضحة وكل حاجة واضحة؟
كله تمام.
طيب احنا معانا.
صحيح، شكرا.
تمام، كويس كويس جدا. طيب في ناس بتحضر معانا النهاردة لأول مرة؟
في دوشة بس مش عارفة عند حضرتك ولا حد تاني.
في صوت دوشة؟
محمد مهاني أول مرة. محمد مهاني أول مرة.
طيب بصوا شباب، مبدئيا كده هستأذنكم كل الناس تبقى قافلة المايك لحد ما اوجه لحد الكلام، علشان ما يبقاش في اي دوشه من حوالينا. تمام؟ فكل الناس اللي مش بتتكلم تبقى قافله المايك. انا دلوقتي بتكلم اهو، ابقى فاتح المايك بس. في حد سامع صوت دوشه تاني؟ في اي دوشه؟
نو كده اوكي.
تمام، كويس جدا. ايه الاخبار؟ عاملين ايه؟ في ناس النهارده، يعني معظم الناس اول مره تحضر معايا النهارده، فعشان كده قبل ما نبدا السيشن بتاعتنا انا حابب اعرفكم السيستم او النظام اللي هنمشي عليه في الكورس بتاعنا. تمام؟ في الاول الناس اللي بتعرفنيش، انا اسمي احمد حسن، انا بشتغل انجلش انستراكتور، بساعد الناس انها تطور الانجليش بتاعها، وانتوا بتاخدوا الكورس دلوقتي مع ال دي اكاديمي. تمام؟ فالكورس بتاعنا هيكون كالاتي: هيكون كل سيشن ان شاء الله عندنا فيه توبيك او موضوع معين، هنتدرب ان احنا نتكلم او نعمل براكتسنج، نتدرب مع بعض ان احنا نتكلم في التوبيك ده. احنا في الكورس بتاعنا هو كورس كونفرسيشن، كورس محادثه. فاحنا هنشتغل على تو سكيلز، يعني هنشتغل على مهارتين: مهاره الليسننج اللي هي مهاره الاستماع، ومهاره سبيكينج اللي هي مهاره التحدث. فاحنا علشان نشتغل على مهاره الليسننج هيكون في كل سيشن عندنا في توبيك او في موضوع معين، هنسمع ستوري او هنسمع ستوري او قصه او كونفرسيشن، محادثه يعني، لمجموعه اشخاص بيتكلموا في محيط التوبيك اللي احنا هناخده او اللي احنا هنتكلم عنه في السيشن دي. بعد ما نسمع الكونفرسيشن او الستوري دي هنسمعها مرتين. هنسمعها مره علشان نطلع بوينتس معينه منها نتكلم عنها، سواء مثلا في مره هسالكم اقول لكم عايزين نعرف ايه الحاجات المشتركه بينكم وبين الشخص اللي في الستوري، او اسالكم شويه اسئله والمفروض ان انتوا تطلعوا الاسئله دي من الستوري. ده الجزء الاولاني. وبعد كده هنبدا نسمع الستوري دي مره تانية، علشان المره دي هنسمعها جزء جزء علشان نطلع كل الحاجات اللي احنا فهمناها او اللي احنا اتعلمناها كاكسبريشنز او كلمات جديده، ونعرف ازاي نستخدمها احنا علشان نتكلم عن حياتنا. تمام؟ ده بالنسبه للجزء بتاع الليسننج. بالنسبه بقى للجزء بتاع السبيكينج، فاحنا كل السيشن هيكون بنعمل براكتسنج او بنتدرب على التحدث بالانجلش. انا اول ما اخلص شرح وافهمكم كل السيستم اللي هنمشي عليه هبدا اتكلم انجلش بس في السيشن، وهيبقى مطلوب من حضراتكم كل واحد فيكم ان هو برضو يتكلم انجلش بس. تمام؟ طب لو في حاجه مثلا انا قلتها او حد من زمايلنا قالها وحد منكم مش فاهمها، هيقول I don't understand او هيقول repeat please، يعني حاجه تبين ان هو مش فاهم، علشان نبدا نوضح الحاجه اللي هو مش فاهمها دي. في اي حد عنده سؤال لحد دلوقتي يا شباب؟ لو حد عنده سؤال يفتح المايك ويتفضل يسال.
لا كله تمام.
طيب احنا المفروض بما ان احنا هنبقى اكتر من شخص في السيشن، فهيبقى انا بنده على كل حد فيكم باسمه علشان اوجه له كلام، فهو هيبقى قافل المايك لحد ما انا ابدا انده على اسمه. يعني مثلا انا عندي هنا احمد عمار، فلو عايز اتكلم مع احمد عمار هنده اسمه علشان يفتح المايك ويبدا يتكلم معايا. لو في اتنين مثلا منكم هيعملوا اكتيفيتي او هيعملوا حاجه معينه، يعملوا كونفرسيشن مع بعض، فهبدا ان انا انده اساميهم علشان يفتحوا المايكس ويبداوا يتكلموا هما الاثنين مع بعض بالطريقه اللي انا هقولها لهم. تمام؟ طيب احنا دلوقتي بقى هنبدا السيشن بتاعتنا، وزي ما قلت لكم لو في اي حاجه حد مش فاهمها هيقول لو في اي حاجه حد مش فاهمها هيقول I don't understand او هيقول repeat please. اوكي يا شباب جاهزين نبدا؟ جايز انا محتاج الناس تتكلم معايا، انا مش عايز اتكلم. انا محتاج الناس كلها ترد عليا. اوكي يا شباب؟
هو المايك كان عندي فيه مشكلة من فضلك، فدلوقتي حالا اتظبط والميتنج كانت بتقفل كل شوية، بس دلوقتي خلاص اشتغلت.
طيب
فأنا
كويس
طبعا
جدا.
معرفش ايه الكلام اللي حصل، بس شكرا جدا مع حضرتك.
طيب هو عموما السيشن دي هتبقى مسجله، وبعد ما السيشن تخلص هبعت لكم اللينك بتاعها علشان خاطر الناس كلها تشوف الفيديو. لو في حد شاف، لو حد فاته المحاضره يقدر يشوفها. اوكي يا شباب؟ فاي حد لسه داخل متاخر ما يقلقش خالص، كده كده هبعت اللينك بتاع المحاضره علشان يقدر يرجع لها بعد كده. طيب دلوقتي بقى احنا هنبدا السيشن بتاعتنا، وزي ما قلنا انا هبدا اتكلم انجلش بس. اوكي؟ today's session or today's topic we're gonna be talking about something called seeing a specialist. Can you see the screen, guys? Everyone, can you see the screen? Can you see what I'm writing here?
Yeah, we can.
Yeah.
We can.
Okay, very good. Okay, very good. So, Ahmad Ammar.
Yes, hello.
Hi, how are you doing?
I'm doing very well. How are you?
Yeah, all good. Thank you so much, Ahmed. So, Ahmed, do you know the meaning of the word specialist?
It's about someone who's doing a specific job, like maybe a dentist or something, fixing a car, detailing a car, something like that.
Yeah, that's right. And when we talk about medicine, you know this word medicine?
I meant a dentist. I'm sorry. Yeah, I know medicine. What that mean?
Yes. So medicine is like a doctor, someone who works with people's health, who helps people to get recover if they are sick or something. So that's the specialist that I'm talking about. So guys, today we're going to be talking about the conversation or the kind of conversation that you might be having with a doctor when you go to visit a doctor. Okay? So there is a difference between the GP. We have a kind of doctors called the GP. So, Ahmed al-Basri.
Yes.
Hi.
Hi.
Do you know when I call a doctor as a GP, do you know what it means? GP?
Actually, I don't know.
Okay, so does anyone know the meaning of GP, guys? Dua,
Yeah.
Hussein. Who said yeah?
Yes, Mr.
Soha? Okay, Soha, what's the meaning of GP? Who is the GP?
General practitioner.
Yes, it's general practitioner.
Yeah.
Yeah, so the word GP stands for general practitioner. Yeah, so the general practitioner is the doctor who is like, you know, he's not specialized in a specific field of medicine, but he is a general doctor. Do you understand, guys, the meaning of practitioner?
Yeah, after graduation, all students in medical faculties graduated as general practitioner. After that, they study to specialize.
Exactly. Very good. Thank you so much, Soha. So, yes, that's right, guys. The GP or any doctor, when someone joins faculty of medicine, they graduate to be general practitioners. And after this, after some years of working as GPs or general practitioners, they can upgrade or they can be upgraded to be maybe dentists or maybe specialized in any medicine field. Do you understand this, guys? Ahmed al-Masri, Ahmed Ammar, Asma, Dua, Ghana, Hussein, everyone.
Yes.
Everyone,
Yes,
do you
yes.
understand? Ibrahim, Muhammad, Oliver, Rahma, Samir, everyone, please, guys, respond. Do you understand?
Yes.
Yeah. Yes.
Okay, so we have two kinds of doctor. We have the GP, and the other one is who? Who's the other one, guys?
Specialized.
Actually, it's the specialist. The specialist. Repeat after me, everyone, by turn, by order. Repeat after me, everyone. Specialist.
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 Yes.
Specialist.
Yeah, so he's called specialist. Yeah. And today's talking or today's session is gonna be talking about, please unmute yourself, guys. Yeah. Please mute the mic. Yes, that's right. So today's topic or today's conversation is gonna be talking about how to make a conversation with a doctor or a specialist if you have any kind of a nagging pain. So this question is for Dua.
Yeah.
Do you know what it means when you have a nagging pain?
No, I don't understand this.
Okay, so does anyone know the meaning of a nagging pain, guys? If anyone knows the meaning of a nagging pain, who can say, please?
I know the meaning of the nagging.
Maybe I can get something.
Again,
We're
please.
talking about general GP doctor يعني. Maybe it is a pain in somewhere in the body and we don't know which specialist we can go for. So we go يعني. So we have to go to GP first and then he will lead us to the specialist.
Yes, exactly. But my question here was, when I say, for example, that I have, please, guys. Soha, yes.
Recurrent pain.
Okay, like when you say that you have a nagging pain, that means that you have a very annoying pain, you know? Like, for example, I can say that I have a nagging pain in my arm, or I have a nagging pain in my neck. So it means that I have a continuous and annoying pain in my neck, or in my arm, or in my leg. Do you get it, guys?
Yes.
Yes.
Yes,
Okay.
sir.
Does any one of you have any kind of a nagging pain right now at the moment?
Yes, I do.
Yes. Me too.
Yeah. So let's start with Azza. Azza, can you hear me?
Yes.
Hi, Azza.
Hi.
Do you have or do you experience any kind of pain right now?
Yes, I have a nagging pain in my knee.
Yeah. So that's the right way to say it. You can say I have a nagging pain in my knee. That's right. I'm sorry to hear that. Have you seen a doctor or something?
Yes, but no solution.
Oh, why? Is it something like critical or something so serious that way?
No.
Okay. So who else, guys? Like Dua, do you have any kind of nagging pain right now?
Not right now, but yeah, actually, I felt something in my knee too.
Yes.
And I went to a doctor, yani, who leads me that I have to make some trainings, and I'm well now.
Yes. So the doctor,
Yeah, he
the
was
doctor
actually
prescribed.
Something related to sports. I don't know the meaning of the word, yani. For
Like some kind of rehab, like some kind of maybe physical treatment or physical therapy or something like this.
Yeah, of course.
Yeah. So the doctor prescribed some physical therapy or some kind of rehab. You know the word rehab?
Because I went before to some doctors who told me that I have to make an operation, and of course I didn't want to make an operation for my knee, yani. And he told me that I have to make some therapy, and I'm well now.
Yeah. After doing the exercise, after following the guidance of the doctor, you feel better now, right?
Yeah, of course.
Yeah.
And I went after that to play tennis again, and I'm happy for this. Thank you.
Yeah, that's so nice. And we're so happy that you feel well now.
Thank you so much.
Thank you so much, دعاء. How about you, Hussein? Hussein Khalid. Hussein, can you hear me? Okay, Ibrahim Abdul Halim.
Yes.
Hi, Ibrahim.
Hi.
So tell us about any kind of nagging pain you've ever had, maybe now or in the past.
Sometimes I have a backache.
Sometimes I have. Repeat again, please.
A backache. Backache.
Yeah, a backache. Yeah. Okay, can you explain the word backache to us, please?
When you got pain with your back,
Yes.
this something you feel when you drive or you make a hard sport, something like this.
Yeah, when you lift something heavy, or maybe you make some kind of heavy sports. Yes.
You feel that you have a pain in your back.
Yeah. Okay.
That brings you from to be a normal person.
Yes.
Sorry if you didn't got me, because I'm just driving my car. So if my voice is too far, please accept this.
No, we can hear you well. We can hear you well, and we got you.
Thank
Very
you.
good. Thank you so much,
Okay,
Ibrahim,
thank
for this. And we want to ask you, Ibrahim, why did you have this kind of backache? Like, why did you have this nagging pain in your back? What happened to you?
I'm driving for a long distance, so I
Like,
got this.
you mean now, or like that's why you had this nagging pain?
That's the main reason, because I got this pain.
Yes, because you drive for too long.
Yes, and I also hold a heavy weight when I was preparing for my house. I hold a
Yes.
heavy thing,
Yes,
so
and
I got
I always lift. It's not carry, it's lift. Lift means to take something from down to up.
Okay.
Yeah. So maybe because you drive for long hours and you lift heavy stuff at home, right?
Yep.
Okay, can you say it again? Can you see the screen, or you can't see it because you're driving?
Just a minute.
If you can't see it, it's okay.
I
Like, we
drive
can
for
wait.
No, it's okay, but I'm just in Ramses area, and it's very hard to drive. Yeah.
Yeah, I know. Okay.
I drive for long hours, and I always lift heavy stuff.
Heavy stuff at home. Yeah,
At
that's
home.
why you have a nagging pain. Yeah.
Yep.
Thank you so much, Ibrahim. Okay. Muhammad Mahani, if you can't keep up with us, don't worry. Just stay with us and try to catch as much as you can. Okay. And now this is for Soha.
Yes.
Hi, Soha. How are you doing?
Hi, mister. I'm fine.
So, Soha, tell us about any kind of nagging pain you've ever had.
Yeah, I have pain on my back.
Now?
Back pain. Yeah.
Yeah, so you can say I have a nagging pain. I want you to use the words that we learn. So you can say I have some nagging pain in my back. Say it again, please.
I don't say learn.
Learn? No, I said I want you to learn and use the expressions we take in the session. That's what I said.
Okay.
Yeah.
Oh.
Yeah.
I have a nagging pain in my back.
Yeah, I have a nagging pain in my back. Pain
Yeah.
back. Say it again.
I have a nagging pain in my back.
Yeah. Okay, and why do you have this nagging pain? What happened?
When I woke up, I have a very painful back, so I struggle to stand up.
Yes, I struggle to stand up
Yeah.
or to get up from bed. That's how you say it. I struggle to get up. But can you, Soha, please explain the word struggle to us?
Okay. Struggle mean hard to do.
Yeah. So, guys, everyone, do you understand the meaning of the word struggle? Suhaila.
Yes, I do.
Yes.
Hi, Suhaila.
Hi.
How are you doing?
I'm doing great, thanks.
Okay, so Soha here was talking about the nagging pain she has. So, do you understand the meaning of of to struggle with something?
Yes.
So, are you struggling with anything right now?
At a nagging pain, yes, I have a struggle with my eyes because I'm not committed to put moisturizing because I had done a surgery,
You've made a
especially
surgery.
LASIK.
Yes.
LASIK? Yeah.
Yeah,
لو
you
في حاجة
made.
غلط قولي.
Yes, of course. I'm going to correct everything you say. Yes.
That's it.
Yeah. So you went on a surgery or you made a surgery? Not I did a surgery, because there is a difference between two
I said I have done a surgery. Is that correct? Or
yeah.
I
When you say that I have done a surgery, it means that you made the surgery by yourself. You are the doctor.
Doctor, yeah.
But when you make a surgery, that means you are the patient. So you should have said, I've made a surgery. Yeah, so say it again, please. I've made a surgery.
I have made a surgery.
Yeah, that's right. And do you feel better now since you made this surgery, the LASIK?
Of course, I see well, alhamdulillah, but the doctor wrote prescriptions that I had to be committed with antibiotic for little days and a moisturizing as a polyfish.
Yes, so the doctor prescribed. Yeah, prescribed what? Again, say it again. The doctor prescribed.
Prescribed is a verb or noun?
No, the word prescribed here is a verb.
Okay.
And the noun is prescription.
Okay, can I say the doctor wrote a prescription?
No, the doctor prescribed. That's the right way to say it. But if you said the doctor wrote a prescription, it's also right. It's also correct.
Okay.
Mm-hmm.
And I have to be use a polyfresh in a long run because this operation cause some sort of dry. I
Yes.
don't know what's meaning. جفاف يعني ايه؟
Yes, so this operation or this kind of surgery causes some eye dry, right? Yeah, it
Yes.
causes some eye dry. Yeah.
But I always forget to put this moisturize on my eye
Yes.
because I remember it when I go to bed. And when I will decide to put it in my eye when I will be in my bed, I wake up.
Yeah, I understand. So you can't. Once you go to bed, you can't put it. Because if you put it, you will lose like the sleepy feeling. Yes, the sleepy feeling. Yes, I understand. Okay. I hope you feel better soon and you get better so you don't need to take this kind of moisture. Yes. Okay. Thank you so much, Suhaila. And now okay. So Ahmad Ammar.
Yes, sir.
When was the last time you visited a doctor?
Actually, that was the last Tuesday.
Why?
I have a dentist appointments every Tuesday. I'm fixing my teeth because I used to have a cavity, and it's almost done.
Yeah, so you see the doctor every week, right?
Yes, sir.
Okay. And do you like going to the dentist every week? Is it easy for you
No.
to do?
No, nobody does.
Yeah, that's right. Okay.
Yeah.
Thank you so much. And how
No
about Ahmed al-Masri?
Yes.
When was the last time you visited the doctor, Ahmed al-Masri?
Actually, I can't remember. It was so long.
Yeah, it's been a while. So if you want to
It's
say
been a
that,
while,
you can
yes.
say it's been a while. So I can't remember. Say it again, please.
It's been a while, so I can't remember.
Yeah. So do you remember why did you go to the doctor? Why? Do you remember why?
Last time I can't remember actually.
You don't
I
remember?
feel well.
Yes. So you don't remember why you went to the doctor in the first place, right?
Actually, I don't know. Yes, I
Yeah.
can't remember.
Yeah. How about maybe a friend of yours or one of your family members?
Actually, maybe my friend went to the
Yes.
doctor because he had
Perfect. Yes. He had what?
I can't remember. I had um
Did he have any kind of pain in any part of his body or something like this?
actually I'm trying to recognize. Oh, I'm trying. Actually, I can't remember. I don't know yet. But
Yes.
maybe we can say that he had a broken leg, so he went to doctor.
Yes. He had a broken leg. Okay.
Yes, so
Yeah.
he went to doctor to have an X-ray and do a surgery made a surgery
To make a surgery.
make
Yes.
make a surgery.
Exactly. Yeah. Thank you so much, Ahmed. Okay, and now this is for Azza.
Yes.
So Azza, when was the last time you visited a doctor?
The last time I visited the doctor was at the last Saturday.
Okay, was the doctor a GP or a specialist?
No, a specialist.
So, like, it's an Egyptian thing, guys, that if we have any kind of pain, we go directly to the specialist, right? Or am I wrong?
Right.
Right. So, but this is not how it works in other countries. For example, I have some friends in USA, and these friends, if they want to go to the doctor, they can't go to the specialist right away. So in that case, they need to go to the specialist they need to go to the GP first. And if they need to see a specialist, the GP did this. The GP
Refer.
perfect, amazing, Soha. The GP refers them to the specialist. So guys, do you understand the meaning of the word refers or refer?
Yes.
Who said yes?
Azza.
Azza. Okay, so when you went to the to the specialist, or when you went to the doctor, could he diagnose your problem from the first time, or it was difficult?
Yes, because it was an ordinary pain in my teeth.
Yes, it was a regular pain. It was a regular pain. And in English, you can say it's quite routine. It's quite routine. Can you understand this expression, guys,
Yes.
when I say that something is quite routine? What does it mean? دعاء.
It's me.
Yes, I understand this. That means that it's something they are doing regularly. Yani.
Yes, something. Actually, when I describe a kind of pain or a kind of sickness or a kind of like issue in my body as a quiet routine, that means that it's not dangerous. It's not high risk. Understand, guys?
Yeah, of course.
Okay, so Dua was talking about like when she visited a doctor. You said that you visited a doctor and he advised you to make a surgery, right?
Yeah,
Why didn't you make this surgery?
because I didn't want to make a surgery in my knee. I know it's sometimes it's not succeed, and some people that I know told me that they felt the same pain or maybe more than before, يعني.
Yeah.
So, so exercise was perfect for me, and after I was getting well, I could do anything I want, and beside I go and make aqua sessions.
Yes.
That was the best, yeah.
Yes. Okay. So Ibrahim, are you there?
Yeah.
Okay. Now Dua was talking about the surgery, and she said that she didn't want to make the surgery. Can you ask her if this surgery was dangerous or not? Can you ask her this question?
Hi, Doc. Doc, do you
Yes,
got me
hello.
or not?
I'm sorry, something went wrong with my mobile. Yes, again, please.
I just said hi, not nothing.
Hi, okay.
I'm just asking you about your surgery. You said that you didn't like to make it.
Yeah.
Okay, but you said that it's very dangerous for you to make this surgery.
I've heard that from some people I know, yani, around me that make
Yeah.
the same kind of surgery, and I was so afraid to make something like that. I don't want to make it because I'm not younger. So I was so afraid of something like that. And I found
Okay,
myself better, getting better after doing some exercise and so on. Yeah,
and you got better.
yeah, Alhamdulillah.
Okay, thanks God for this.
Thank
Okay,
you.
so guys, thank you so much, Dua and Ibrahim. But like, you know, if you wanna ask someone about a surgery or an operation, if it's dangerous or not, you can ask him this way. You can say, was it a high risk operation? Huh. Can you ask her this question again, Ibrahim?
Yeah.
Okay, was it a high risk operation
Yes.
or
Yes,
not?
I thought it was risky.
Yeah. Thank you so much. Thank you so much, both of you, Ibrahim and Dua. Thank you so much,
Thank
guys.
you. Thank you.
Okay. Hi, Nahla. Nahla, can you hear me? Nahla? Okay. So, Suhaila and Soha,
Yes.
both of you, I would like you to have a little conversation together. Like, I want you, Soha, to tell Suhaila about the last time you've been in a surgery, or maybe you was about to make a surgery or something, and you tell Suhaila about it. And I want you, Suhaila, to ask her about this surgery. Was it a high risk surgery, or it was a quiet routine or something? Suhaila, can you hear me?
Yes, but can you repeat it again? Because I didn't understand the whole sentence.
Okay, Soha,
Yes.
did you understand what I said?
Yeah.
I want you now to explain it to Suhaila and motivate her to make the conversation with you. Can you do this?
Okay.
Yes.
Mr. Ahmed asked us to conversation about my last surgery, my last visit a doctor. So after that, Sohaila can ask me about that this operation is high risk or not. Okay?
Yes. So you get it now,
Okay.
Suhaila?
Yes.
Okay, so
Thanks.
let's do this, guys. Yeah.
Okay. 3 years ago, I was hyperhidrosis case. I know that no one can understand the meaning of hyperhidrosis because it's a medical term that no one can understand, even doctors. That mean hyperhidrosis case mean that I have sweat in my hand and my legs. So that annoyed me. So I have make operation or surgery.
Yeah, so you mean that your hands and legs sweat so much? Yeah, when you hold something with your hands, you feel that you have a lot of sweat, right?
My hands and my leg all the time is wet.
Yeah.
Are wet.
Yes. Okay. So do you understand now, Suhaila, what Suha said?
Yes, maybe.
If you don't understand, you can ask her to explain more.
Okay, I understand from her that she has a problem in her hand, and it's called hypernosis.
Say it again.
Hypernosis. Hyper. Okay. 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 Tell me, how many days do you need to or take for the treatment after the surgery or after the operation? Please again, how many days? What? How many days do you take for the treatment after the surgery? Do you make a surgery? Surgery is not complicated. In the past, is very dangerous. Nowadays, it's very simple because we can do it by endoscope. In the scope? endoscope منظار بالعربي منظار.
Yes. Yeah. So now you can make this surgery with endoscope.
Yeah.
Yeah.
In the past, before before we discover endoscope, it's very dangerous and difficult.
Yeah.
Okay, and which type do you make? Which, the first one or the second one? Which?
Yeah, she's talking if you made it with endoscope or the old way.
No, the old way isn't available now in hospitals. It's in the past. It's very difficult and serious. So no one can do it.
Yeah, so the old way is no longer available.
Yeah. No doctors now. No doctors now do operation without endoscope.
Yes. Okay, so Suhaila, do you have any other questions to Suha?
Okay. Can I say there is any tablet that that the doctor prescription for you for this surgery or for this operation? After operation or before? Both. Okay, if you mean that if that any medicine I should take replaced by operation, يعني اخد علاج بدل ما اعمل العمليه.
Yes, like if you want to say this, you can ask. Okay, if you want to ask this question, okay, guys, listen to me just a second. If you want to ask her this question, Suhaila, if you're asking her about other treatment options, so you can ask her and say, were there any other treatment options? That means, like, could you do anything or could you have done anything without or instead of making the surgery? Is that what you want to ask her about, Suhaila?
It's a good way, but I asked for another question.
Yes.
I said, what is the protocol after the surgery or after the operation?
Yeah.
If there is any type of medicine. Okay, after operation, like other operation, you just take antibiotic for secondary bacterial infection, analgesic, just to relieve pain, like any surgery.
Yes.
and any tablets for a long run long term عايزة أقول لمدة طويلة.
No.
Yeah,
Like
for a long period of time.
Okay. Okay.
Okay. Yes. Thank you so much سهيلة and Suha. So guys, أحمد المصري, عزة, دعاء, Ibrahim, any one of you, do you have any question to ask Suha about her surgery? أحمد المصري, عزة, دعاء, حسين. Okay. So دعاء, are you there?
Yeah.
And Ahmed al-Masri, are you there? Thank you so much, Soha.
Yes, I'm here.
Okay, so Ahmed al-Masri and Dua. I want you now, Ahmed al-Masri, to ask Dua about the other treatment options she had instead of making the surgery. Can you do this?
I will try.
Okay.
Ask whom?
Dua.
Okay, Dua. Can you tell me about if there were any treatment options instead of your surgery?
Yeah, of course. Actually, it was some trainings and some exercises, plus the aqua, which make me feel much better than before. And I felt
mean-
that, yeah,
You mean rehabilitation or physiotherapy, right?
excuse me?
You mean rehabilitation or physiotherapy?
Yeah, it's physical therapy.
Yeah, so they call it physiotherapy. Like that's how they call it. The physical therapy. Yes. Okay, continue,
Yes.
please, guys. Yes. You have any other question to her, Ahmed?
Actually, I'm hearing her, and she must continue.
Okay, continue, please, Dua. Yes.
Actually, I don't find anything to say. And
Yeah, she only said that she made some physiotherapy and some exercise. That's what she said. Yeah. Okay.
That was the only option.
Yes. Okay. I want you now, Dua, to ask Ahmed if he has been like through any operations or any surgeries before. Can you ask him this question?
yeah.
Okay.
Ahmed, did you have any therapy?
You mean surgery or therapy? You mean surgery, right?
Sorry. Any surgery?
Yes, actually, I had one surgery before in my stomach.
Your stomach?
Yes, removing. Actually, I don't know the name in English, but it's the additional part of the stomach. I don't know its name yet.
Can you help us with that, Soha?
Gastrectomy.
Gastrectomy.
Yeah.
Marara?
No, not.
Okay.
Gastrectomy.
It means yes.
The additional part of the stomach. يعني,
A part of the
it was
stomach?
infected. It was flamed. يعني, it was flamed and infected.
Stomach medical, it's gastric. So if you have any
اللي
QC,
هي I'm sorry يعني ممكن بالعربي يعني
زايدة.
دي زي
زايدة, right?
ارتجاع
Yes.
اوكي
زايدة.
اوكي something else
زايدة, yes.
زايدة اوكي.
Yeah, so tell us about this surgery, Ahmed. What happened?
Actually, that day I was eating koshari with more spicy. And
Okay,
it was spicy koshari.
before you continue, Ahmed, please, just a second. Susu Musa. Susu Musa, can you hear me? Are you there? Unmute the mic, please. Okay. Ibrahim.
Yes.
Okay, so Ibrahim, can you ask Ahmed al-Masri about this surgery, please? Or you're driving. If you're driving and you might get distracted, So you can listen until you finish driving. Until you reach.
No, sometimes I can balance between driving and talking, so it's okay for me.
Okay, so please go ask Ahmed al-Masri about his surgery.
Hi, Ahmed.
Welcome. How are you?
I'm just asking about your surgery. Was it a high risk surgery or not?
Actually, it wasn't risky at all. It was very easy for me.
It was very easy.
Yes.
Yes, it was very easy because I had a drug. I told the doctor to give me a drug for not feeling anything, and he gave me a good drug. So I started. Actually, I couldn't feel anything until he finished. Actually, I only smelled like a meat, a flamed meat only, but actually I didn't feel any pain.
Oh, okay. And did you got any other treatment? Just
Actually, after actually
surgery.
after actually after made this surgery, I take a long rest and I take a much solutions, IV solutions, and take also antibiotics and other treatments which I couldn't remember until now.
Yeah.
Okay, thanks.
Yeah.
Okay, thanks, Ahmed.
Okay, thank you so
You're
much.
welcome.
Thank you so much for both of you guys. Now, Azza.
I'm sorry, Ahmed. I
Yes.
just got a notification that says that you have 14 minutes only, and then the call gonna be end.
Yeah, don't worry about this, guys. Once the call ends, I'm going to send you another link. Don't worry about this. Okay?
Okay, thanks.
Yeah. Okay, so now Azza, I want you, Azza, to ask Hussein if he's been through any kinds of surgeries before. Can you do this?
Yes.
Okay,
Hello,
do it,
Hussein.
please. Sorry, not Hussein, Ibrahim, sorry. Ibrahim, not Hussein.
Okay. Hello, Ibrahim.
Ibrahim again, or another one?
No, you.
I'm the only one, Ibrahim.
Yes,
In
you.
this group,
Like, I want Azza to ask you. Now you're gonna answer her.
Okay.
Okay. Hello, Ibrahim.
Hello, hi, Azza.
I'm fine. Have you been through any surgeries before?
No, thanks God, I didn't get any operations or made the surgeries before.
Okay.
You can ask him if
That's
he has any family members, maybe a friend. The point of this, guys, is to be able to express these things. Maybe to talk about yourself or to talk about someone else, guys. So,
Okay.
or even
Okay.
to make something up. To make something up means to say something that is not real. Got it, guys?
Okay. Okay. I'm
Yeah.
gonna talk about my wife. She got a pregnant surgery,
Yes. A pregnancy
and
surgery. Yes.
we got a new baby. That's my last surgery I've ever.
Yeah, and Azza, you can ask him if it was a high risk surgery or it was easy. So you can ask him. You can try to ask him about the surgery he was talking about.
okay.
Yeah.
Was it a high risk operation?
No, it was easy, but after the surgery you have to take strong antibiotic
Yes.
to avoid any pain, uh, and she had to stay at the hospital for 1 day.
Yes.
I'm
Okay.
sorry. I'm sorry. What type of operation you say about?
He was. Yeah.
About
Explain it to
pregnant,
Soha. Yes.
pregnant.
She was given birth, Soha. She was given birth.
Okay, cesarean.
Yes.
Okay.
I don't know if it
Is
was
there?
natural or cesarean. Like, you can answer this question too, Ibrahim.
It was cesarean. Yes.
Mm-hmm.
No. Natural. So she had to take an antibiotic for 1 day, and she was holding this around her neck. I don't know if you faced this antibiotic before or not. Do you know it?
No, I can't understand. I'm sorry.
Okay, he's talking about a kind of antibiotic, and she had to put something around her neck. Is that what you said, Ibrahim?
Yes.
It's an analgesic to relieve pain.
Yes.
Okay.
Is it a painkiller or something? What's this? I don't know. Okay, but anyways, thank God she feels better now and she got recovered from this surgery. Looked like it was
Thank.
like painful. Of course, it was it was painful. Yeah. Okay.
Yeah.
Suhaila,
Yes.
have you ever been in any kind of surgeries before, Suhaila?
Yes, I said before.
You made
have
LASIK.
done.
No, I'm not talking about LASIK. I'm talking about any other surgeries.
No,
Okay.
alhamdulillah.
Yeah, thank God. Okay, no, Samir Meher or Samar? What's this? Are you Samir or Samar?
Yes, Samir Meher.
Samir.
Yes.
Hi, Samir. How are you doing?
Fine. I'm done.
Okay, now Samir, Suhaila made a surgery called LASIK for her eyes.
Yes.
Can you ask her about this surgery? Was it risky or was it easy? Can you ask her about this surgery?
Yes, because I will ask here because I did it before. Suhaila, what you feeling when the doctor started to make to start to started to make the surgery the LASIK in your eyes.
Okay, so the question. Okay, before you continue, Suhaila, please, if you want to ask this question and to make it more understandable, Samir, you need to ask her, how did you feel when the doctor started to make the surgery? Can you say it again?
Yes. Okay. So Haila, how did you feel when doctor started to make the LASIK operation?
Yes.
I felt like I was nervous and worried about this surgery because it's the first time in my life to make a surgery to go to the hospital أصلا.
Yeah.
So when I have gone, the doctor the doctor was trying to makes me comfortable and say to me it's so easy. Of course, you make a research on YouTube and you found it so easy. It's only a quarter or a half hour and a half hour. And after that, when he trying the operation, he told to me the steps in the first eye. Every single step, as example, he told to me, Suhaila, you will see now a red, maybe a red or a green light. You have to focus on this until I finish it. And you trying to didn't focus on any something else.
Yeah, try
Only
not to
focus on this
focus.
challenge.
Try not to focus on anything else. Again, try not to focus on
Try
anything.
There's no helping verbs in this sentence.
Yeah, try not to focus.
Okay. Okay. Try not to focus on anything else.
Yes.
And at the end, when he finished the first eye, he was began with the second eyes, and he didn't. This is the worst part in the story. In the second eye, he didn't told me the steps. Do you know? And I forget what the steps. What should I do?
Okay,
سامعني ولا لا؟
Suhaila, we hear you, but
عربية.
there is so much noise coming from your part. That's why. But we can hear you, but there is noise.
Because I'm in a car. Sorry.
Yeah, it's
Now
okay.
it's okay.
Yeah, it's okay. It's better now. Okay.
Can I one quick?
You have a question, Suha?
Yeah.
Yes?
To Suha.
اتفضلي.
No, don't say it for Dolly. We're not in an Arabic session here. You say, go ahead. Or please. Yes, please. Yes.
Please go ahead.
Yes.
Okay, this operation is done by local anesthesia or general anesthesia?
What did you say? I'm not in a medicine sector, okay? So please.
Yeah. Try to simplify it. Try to simplify it, Suha, please.
بتعمل لي العملية دي بتخدير كلي ولا
Yeah. Do you take full
I was
drug?
remember.
Or have you taken full drug? Or have you drugged fully? That's how you say it. Have you drugged fully or half? Or only a half?
Sorry,
drugged.
can I help you here, please?
Yes, please.
Because I did this surgery.
Yes.
There is some drops put it in our eyes before the surgery.
Yes.
It's called local anesthesia. يعني anesthesia is this part only in your body, but general anesthesia that you are asleep.
No. It is a part.
It's just a part
They put it
anesthesia.
in our eyes. Some
Yeah.
drops like drugs. Yes. Okay.
Yeah. Okay, so it's only there are only some drops that they put in your eyes to make you drugged. Yeah.
Ahmed, sorry.
Yes.
Ahmed, sorry. Could you please write the idioms she said about medical?
Actually, I wrote them here. She wrote some idioms and I added them to the file. Like this one, right?
Yes. Sorry, I'm just driving, so I couldn't read.
Yeah. Okay, no problem. Okay, guys. Yeah, like I enjoyed the conversation with you, but now let's move to the second part of the session, which is that we're gonna listen to a conversation, a story for someone who went to see a doctor, and he's telling us about his journey, what happened. Okay, mute the mic, please, Ibrahim. Yes, thank you. Okay, so we're gonna listen to a story now for a person. This person visited some doctors because he had some kind of nagging pain in a part of his body. I'm not gonna tell you about this part, but I want you to try to get it from the story. Okay? So we're gonna listen now to the story. And after this,
I'm sorry, repeat again.
okay, I was saying that we're gonna listen to a story for a person, and this person went to see some doctors because he had some nagging pain in a part of his body.
Okay.
So we're gonna listen to this story together.
Sorry, Mr. Ahmed, please, can you repeat about nagging pain? Because I didn't heard before, because I had a joint now.
Okay, so now I'm gonna ask Azza.
Yes.
Can you explain the meaning of nagging pain to Ibrahim?
Yes.
Or Samir? Samir or Ibrahim was asking?
Samir.
For Samir, yes.
Yes.
Nagging pain means a continuous and hard pain.
Do you get it now, Samir? The meaning of nagging pain?
Yes. Thank you.
Have you ever had any kind of nagging pain before?
Thanks God, no.
Yeah, that's nice. It's good to know. Okay, guys.
But I got nagging pain for another person.
Who is that person?
my son.
Yeah, you can tell us about it.
But it is not. I will tell you about this story, because this happened 2 months ago, when my son got information about his got information from the doctor about him, like he has diabetes. This make him very nervous that time, and I got the same impression also.
Yeah,
It's
how
very,
old?
very difficult, because my son is have 18 years.
Yeah, he's just 18. Yeah, so don't worry about it, guys. This session is recorded, and if you miss anything, I'm going to send the link of this session once it's uploaded. I will send you the link so you can watch it again and you recap what you've missed. Okay?
Thank you so much.
Okay.
Yeah. So guys, now let's listen to the story, and I want you to focus on the answer of some questions related to this story. I'm going to write the questions, and I want you to listen and try to find the answers of those questions, okay? The first one, what part of his body, what part of his body he had the nagging pain? Where exactly in his body? In his body. That's the first question. The second one, what did the doctor advised him to do? That's the second question. The third question is about what did he decide to do by the end of the conversation, or by the end of the story. So I want you guys to focus on finding the answers of those three questions. Do you understand the questions, guys?
Yeah.
Yes.
Yes.
Okay,
Yes.
now let's listen. Now, very good. Thank you so much. I want to make sure that everyone is here. So, Abdurrahman. Abdurrahman.
Yes.
Hi.
Hi.
Okay, don't worry about what you've missed from the session, because this session is recorded and I'm gonna send you the link after we finish, okay?
Okay.
Okay, so Samir, Dua, Azza, Suhaila,
Yes.
do you
Yes.
everyone, do you understand the three questions I've wrote?
Yes. Yes.
Yes.
Okay, now let's listen, guys. Yeah.
Sorry for interruption, but I don't get the target from these questions, because maybe I missed the whole first part.
Okay, we're gonna listen to a story now. A story of a person. This person is talking about, like, when he visited a doctor and because he had some kind of nagging pain in his body. Do you know the meaning of nagging pain, Shireen?
Yes, maybe some irritating issues in his body, but he doesn't know exactly where is it.
Yes, exactly. Perfect.
Okay.
Actually, he knows.
Yeah.
He knows where is it, but he doesn't know how to treat it, how to recover
or
from
maybe
it.
the reason behind them.
Exactly. Yeah. So we're gonna listen now to the story, and while listening to the story, I want you to focus on finding the answers of those three questions.
Okay.
Get it now?
Thank you so much.
Thank you, Shireen.
Yeah,
Thank you.
got it.
Let's do it, guys.
Knife. The dialogue this time had a pain in my leg.
Yeah, from here, guys. Yes.
I went to see my doctor because I had a nagging pain in my leg. After he examined me and did some routine tests, he suggested that I go see a specialist. I made an appointment with Dr. Slope.
Good morning. How are you today?
I'm fine, Dr. Slope. My GP, Dr. Harding, referred me to you. He thought that you might be able to diagnose the problem with my leg.
Well, let's take a look. I want to order some tests, but I think you may need surgery. It's a simple procedure and it'll relieve your pain.
So it's not a high-risk operation?
No, not at all. It's quite routine.
Are there any other treatment options?
Not that I recommend. This is the best course of treatment in my opinion.
I was really surprised by what Dr. Slope said. I really didn't want to have surgery. I think I better get a second opinion before going under the knife.
Okay, guys. So, please, everyone, yes. I wanna ask you. Do you understand this story, or you need to listen one more time?
One more time.
Yeah, I got it.
Yes, one more time.
Okay. So, anyone who wants to listen one more time, raise your hand in the in the chat, please. So we have here Samir, Azza, Suhaila, Suha, Abdurrahman. Yes. So guys, we're gonna listen again one more time. I only want you to focus on the answers of those three questions. Okay, guys? Only the answers of those three questions. Once you get the answer of those three questions, that's the point, and that's all what you need from listening to the first time. Okay? Because we're gonna listen again after that, after we cover all these questions. We're gonna listen again to this story, but this time we're gonna listen a piece by a piece, okay? So this time I only want you to focus on finding the answers of those questions, okay?
Okay.
Yes, so let's listen again.
Then cut you open. Knife. I went to see my doctor because I had a nagging pain in my leg. After he examined me and did some routine tests, he suggested that I go see a specialist. I made an appointment with Dr. Slope.
Good morning. How are you today?
I'm fine, Dr. Slope. My GP, Dr. Harding, referred me to you. He thought that you might be able to diagnose the problem with my leg.
Well, let's take a look. I want to order some tests, but I think you may need surgery. It's a simple procedure and it'll relieve your pain.
So it's not a high-risk operation?
No, not at all. It's quite routine.
Are there any other treatment options?
Not that I recommend. This is the best course of treatment in my opinion.
I was really surprised by what Dr. Slope said. I really didn't want to have surgery. I think I better get a second opinion before going under the knife.
Okay, how about this time, guys? Do you get the answers of the three questions?
It's clear. For me, it's clear.
Okay, and you, Azza, Samir, Shireen, Soha, Sohaila, Ibrahim, Dua, everyone, please, guys, please. If you don't understand, just tell us.
No, it's clear.
No, it's okay.
It's clear.
Okay. And for you, Azza, it's clear, right?
Yes.
Okay, Sohaila.
Hello?
Yes.
Yes.
Do you get the
It's okay.
answers of the three questions?
Maybe only two. I got it.
You got only two of them?
Yes.
Okay, so let's start by the first question, Suhaila. What part of his body he had the nagging pain in?
His leg.
Yes, he had some nagging pain in his leg. I think this is a very easy question, right, guys?
Yeah.
Yeah. Okay, thank you so much, Suhaila. And for you, Soha,
Yes.
what did the doctor advise him to do?
He had advised him to see a specialist.
Are you talking about the first doctor, the GP, or the specialist?
The GP advised to see a specialist. The specialist say that he
Okay, let's stop here. You said you answered a part of the question. Okay? Thank you, Soha. Now, Shireen.
Yes.
Okay, so Soha said that the GP advised him to see a specialist. Do you think so?
Yes.
Do you agree with that?
Yes, she's right.
Yes. And how about the GP? How about the specialist? What did she advise him to do?
Well, after diagnosing, he just said he needs to have like a surgery.
Yeah. Okay.
This is
And
the best solution for his pain, to release his pain.
yeah. Okay. And this doctor, this specialist, was a man or a woman?
I think she
You
was
think?
a woman.
Yes, she was a woman, of course. Yeah.
Yeah, yeah.
Her voice
Yeah.
looked like a woman. Yes.
Yeah.
Okay. Thank you so much, Shireen.
Most
Okay.
welcome.
Yeah. And Samir.
Yes.
Okay. Do you think that the person in the story was happy with the idea of making a surgery?
No, he wasn't happy with that opinion from the doctor, and he wanted to go to another second opinion.
Yeah, he wanted to get Yeah.
Surgery.
Yeah, he wanted no. I'm not talking about the surgery. He wanted
Okay,
to
to
get
get first opinion, and he wanted to go for second opinion.
yes. So he wasn't convinced with the first opinion or with what the doctor said, and he decided to get a second opinion.
Opinion, yes.
Yeah, so he wanted to get a second opinion. Okay?
Yes.
Very good. Okay, thank you so much, Samir.
Thank you.
For you, Ibrahim, if you are in this situation, would you believe what the doctor say and you agree with her that this is the best course of treatment and you would go for the surgery, or what we should do if you are in this situation?
For me, I'm gonna do the same. I'm gonna have another opinion.
Yes.
Because from her voice, I thought that she is not confident with her opinion, because she said I prefer not. She said that the only solution for your pain is to get a surgery.
Okay, so the doctor.
Am I target or not?
Okay, Dua. I will leave Dua to answer this question. Do you think, from the voice of the doctor, was she confident or not?
Yes, she was confident, so confident.
Like you can try to prove your point to Dua. I'm not sure, Ibrahim.
Yeah, I did it before, the same thing. I just got a second opinion, of course, for my leg.
Yeah.
I didn't make a surgery.
Yeah. So, like, you made this because of the surgery itself, or because you wasn't convinced, or you weren't convinced with the doctor?
Not at all, but I think it was risky, and I didn't want to make a surgery anyway.
Yeah.
I wanted to see another solution.
I think
it's not easy for everyone. Yeah.
You think what, Ibrahim?
It's not easy for anyone to take the first decision to make a surgery.
Yeah. Okay, and for you, Shireen, if you are in this situation, what would you do?
I think here there's something very important to take care of, which is we are talking about diabetic person. So in such cases, I think it's very, very essential to seek another opinion, because it's a little bit risky, as Dua said, to go on a surgery for the diabetic reasons, and it's may cause a lot of consequences.
Yeah.
So that's a basic reason for going or asking another consultant.
Yeah, it may cause some critical issues or some side effects.
Definitely.
Yes, and yeah, you need to go or to get some second opinion. Yes, that's right. Thank you so much, Shireen. And yeah, okay. So, like, Azza, are you there?
Yes.
Okay, the person in the story asked a question to the doctor when she said that he needs to make a surgery. Do you remember this question?
Yes, he asked her if the operation high risk.
Yeah, so he asked her if it's a high risk operation. Can you say it again?
He asked her if it is a high-risk operation.
Yes. Okay, imagine that you are in this situation, Azza, and the doctor told you that this is a quiet routine and it's not risky at all. Would you make this surgery? Would you go through it?
No, I don't think so because surgery in bones, especially in bones, I think it is not good or not ordinary.
It's not common.
Not common.
Yeah,
Yes.
not common and not easy. Yeah, so it's a tough decision to make. It's
Yes.
a tough decision to make. Yes. Okay. Thank you, Azza. Thank you so much. Okay, Abdurrahman.
Yeah, I
Okay.
hear you.
Yeah. What was the decision that the person in the story decided by the end of this story?
He decided to go another maybe another doctor.
Yeah, he decided to
Go to another doctor.
yeah, to go to another doctor. Yes.
For take another advice.
Yes, to get can you help him, Ahmed, with the expression that the person in the story used? Ahmed al-Masri.
Yes.
Huh.
The expression he decided to get another a second opinion and then not to go under the knife.
What does it
and,
mean to
not
go under the knife, Ahmed?
having اللي هو made a surgery يعني not to make a surgery. Or not to make a surgery.
Not to make a surgery. Yes. Okay. Can you, Ahmed, ask Abdurrahman if he's ever been in a surgery before or he experienced something like this before? Can you ask him this question, please?
Have you been in a surgery before?
Actually, no. I don't have any surgery before now.
I haven't been through. I haven't.
I haven't been through.
Yeah, I haven't been through any surgeries.
Any surgery before.
Before. Perfect. Yeah.
I'm happy
Thank
for
God.
you, and I hope God saves you always.
Yeah. Thank you so much for both of you, and thanks so much for everyone. Thank you so much for all of you guys. Abdurrahman, Ahmed al-Masri, Azza, Dua, Ibrahim, Shireen, Soha, Suhaila. Actually, the session with you was so nice and fun, and I enjoyed the session with you a lot. So I would like to thank all of you guys.
Thanks a lot.
Thank you.
Thank you so much, guys. Do you have any question before we end the session? Is anyone have any question?
Yes, I have a question.
Yes, Suhaila.
About actually there's two questions. We wanted to make a comparison between two sentences that I was confused. Like I was watching a TV and I found her said, "Is she gone?" Okay, this is the first question, and the second one, I was bored. What is the sense of both?
Okay, I didn't hear the second question. Say it again because I didn't catch it again. Please.
I was born. I was born.
Yeah.
That's it.
I was born.
Yes.
Yes. Okay. So let's start by the first one. You said that what was the sentence or what was the phrase you've heard?
The first one.
Yes.
Is she gone?
Is
which
she gone?
I know is or any verb to be with after noun. It's a present simple.
Yes.
Okay, and is with a verb ing. It's a present continuous, and when I was thinking about this sentence, I didn't know what is the sense
Yeah.
about this sentence.
Yeah. Yeah, that's the point that we always talk about, Suhaila, that some Americans, some people, especially in movies and songs, they don't follow the grammatical rules. They don't follow the rules we know. So if you want to follow the rule, so you can say, did she go or has she gone? Not is, actually. Okay? So sometimes they make these kinds of mistakes, you know, because this is everyday English, you know?
In the first, I was talking like that, and there's someone tell me, "What? There's no rules in English like that." And after that, I was confused. I had to choose what should I do first.
Yes.
What should I do, or what should I talk? And before that, I had to thinking. I had to think.
Yeah. I understand you. Okay, so the right way to say this question, you should have said, has she gone? Okay? So, yeah. So instead of, or to get away from the confusion and confliction with some people who might not familiar with this, so you should say it that way. So when you see a mistake, or when you see someone says something unpopular or uncommon on the TV or in a movie or whatever, so try not to say it. Try to use the basic way you know until you find someone that you can speak freely with. Okay?
Oh, and what is the reference to me?
Yeah.
Because you said I have to not refer or depend on film.
Yes.
So what's the reference?
Okay, actually, the reference is to try when you see a sentence, okay? Try to get it back to the rule you know. If you find that it's logical, so use it. If it's not logical, try to fix it. Maybe you show it to me, you show it to someone you trust, and then they help you correct it, like what we did here.
I got it.
Okay.
Sorry, I will ask you a second question.
Yes.
This is actually maybe it's a proposition. True and true up. When you say what have you been through any surgery in your life? And
Yes.
I remembered there is a throw. It is related with up, which is mean. Do you have to up these units, or did you review these units? Do you
Yes.
understand me?
Did you go through? Did you go through?
No, I think there is like something like up in after throw.
Okay, like you know, when you throw out something, that means it's like when you use the word up. That means you do it carefully or you do it in a very accurate way. It's not just like to look at this, no, but you look at the details. So if you want to confirm the way of doing something, so you can use throughout. So, did you go through these things or did you throw out these things? That means, did you do it completely? Understand?
Okay.
It's like, for example, sometimes when you use the word up, for example, when I ask you to eat, for example, if you're eating, I ask you to eat. So you can eat, Suhaila. That means you eat however you want. But if I ask you and say, eat up, that means you need to eat the full food or the old food. Understand? You need to eat all everything. Understand?
Throw up, which it means I have to finish it.
Yes, to eat it up. Yes, to eat your sandwich up. That means you finish it all. Understand? So that's the same. Sometimes when they use the word like out, a word like up, that means that you do something completely. Yes.
Okay, thank you, Ahmed.
Thank you so much, Suhaila. Okay, for the rest of our friends, do you have any other question, guys, related to this session or related to anything else?
Mr. Ahmed,
Yes, sir.
in example that is she gone, I think that is the street language like in Arabic العامية.
Yes, that's like the slang language.
Okay.
Yes, exactly. Okay. Shireen, Ibrahim, Dua, Azza, Ahmed, Abdurrahman. Do you have any other question, guys?
No, all is good.
No, thanks. Thanks, Mr.
Thanks for
Ahmed.
your patience.
Thank you.
Thank you so much, guys. I hope you enjoyed today's session. Please, for everyone who enjoyed the session and found it useful, write a review on the group after you finish the session. Thank you.
Thank you, Mr.
Thank you
Ahmed.
so much. And see you soon, inshallah. Thank you so much, guys.
Thank you.
Thank you. Bye.